हेलो गाइस, यू मोस्ट वेलकम ऑन मित्तल्स एजुकेशन पॉइंट यूट्यूब चैनल। आज हम डिस्कस करेंगे अबाउट डोसेज फॉर्म ऑफ द ड्रग्स, डिफरेंट डोसेज फॉर्म्स एक्सेट्रा। दिस इज अ सीरीज ऑफ फार्माकोलॉजी प्रैक्टिकल्स। Myself Avi Mittal and I'm a third prof MBBS student from a PGMS Rohtak. So let's begin. Solid dosage forms. First of all, we have tablets. In tablet, we have oral tablets. In oral tablet, first example is immediate release or uncoated tablets. Like Disprin, paracetamol, they go and start action. Then we have sugar coated tablets. In sugar coated tablets, what we have? In sugar coated tablet, beneficial is covering up drug objectionable taste like chloroquine, etc. Like in sugar coated, the tablet is coated by sugar and the taste is masked by sugar to increase palatability and compliance of patient. Okay. Then we have entry coated tablet. Entry coated tablet are coating made up of cellulose plus carotene. Protection from secretions of stomach. It protects from secretion of stomach. It go to the required site and start performance. Like diclofenac and pantoprazole. Then we have sustained release tablet and controlled release tablet. Sustained release tablet release at variable rate generally don't follow zero order kinetics, but controlled release tablet at release at constant rate and follow zero order kinetics. Sustained release we have example of alprazolam, bupropion, and in controlled release tablet we have example of morphine sulfate. Then we have sublingual tablets. Sublingual tablets like nitroglycerin, prochlorperazine. These are used for emergency condition or when we require very fast onset. Okay. Mouth dissolving tablet. Mouth dissolving tablet are like calcium tablet, albendazole tablet, vitamin C tablets, specially designed for patients who are unable to swallow, like old age, PEDS patient, or the patients who are supine and bedridden, like they are not able to eat, etc. We just put the tablet in the mouth and close the mouth, it will dissolve ultimately. Then we have vaginal tablets. These are for they are to be put in vagina, like cotrimazole, metronidazole, like pessaries. What are suppositories? Suppositories are bullet-like tablets, bullet-like soft. Pessaries are also for pessaries are like suppositories but for vagina. Suppositories are for rectum, like diazepam, PCM, etc. Then we have capsules. Capsules are two type, hard type and soft type. Hard capsules are like amoxicillin, levosulfide. Soft capsules are vitamin A capsules, digoxin, etc. Then we have powders. Powders we have medical powder, surgical powder, and bulk powder. Medical powder are superficial skin wounds to be used on superficial skin wounds. Surgical are to be filled in cavities like body cavity, major wounds, burns, umbilical cord, etc. And bulk powder are to be applied in bulk quantities like laxatives and to administrate itraconazole, zinc, and laxatives. Then we these are solid. Then we discuss about semi-solid forms. In semi-solid forms, first of all we have ointments, cream, paste. What is the difference between in three? Ointment is greasy, cream is smooth, and paste is thick. Example: greasy Vaseline, smooth water in oil and oil in water emulsions type, and paste non greasy होता है. Special point: optimum delivery and optimum action like moisturizer. Cream are for gentle rubbing is required, and in paste don't melt at body temperature. They do not melt, like if you put it will stay there. Example: sulfur ointment, petroleum jelly like Vaseline, cream, hydrocortisone, cold cream, shaving cream. This is super smooth, and paste, toothpaste. It if put on the skin, it will persist. Then we have liquid. Liquids. First of all, we have solutions. Parenteral administration. These are used for parenteral administration. Sterilized like normal saline. DNS means dextrose and normal saline. Syrup. Saturated solution of sucrose, purified water, alcohol, demulcents, smooth mucous they demulcents soothes the mucous membrane and they also works like cough preventive agent. cough syrup, dextromethorphan, paracetamol syrup, etc. Then we have elixirs. What is the difference between syrup and elixir? Syrup is used in purified water, and alcohol is the preservative. And in elixir, the alcohol is the base. Okay, these are preparation of alcohol. They are pleasantly flavored solution, and the difference will be like the component which can be dissolved in water. It is syrup, and the component which only dissolve in alcohol don't dissolve in water can be like elixirs only. And stabilize active ingredients, they mainly contain ethanol. Like stabilize active ingredients retard crystallization of sugar, provide certain sharpness, mask unpleasant taste of ingredients, antihistaminic like chlorpheniramine and chloral hydrate. And then we have liniments like external application on unbroken skin with friction, analgesic soothing property, turpentine liniment, etc. In lotions, we have eternal applications on unbroken skin gently, astringent, antiseptic, antipruritic, cooling, drying, protective properties there, calamine solution, etc. Then we have nasal drops. Nasal drops are neutral pH, viscosity similar to the nasal secretions. Xylometazoline, ipratropium, oxymetazoline, mainly they are used as decongestant. कंजेस्टेंट कब होता है? जब वेसो डायलेशन होता है. We use vasoconstrictor for decongestant. Okay. Then we have eye drops. Eye drops like analgesics, anesthetics, anti-inflammatory, miotic, hydrotic effects, anything like gentamicin, latanoprost, pilocarpine, etc. Then we have ear drops. In ear drop, draining wax, gentamicin, hydrocortisone, neomycin, etc. Then we have enema. This is important. Enema is of two types. This is liquid preparation for rectal administration. We have also studied about solid of rectum. What is the answer? Answer is suppository. Example, PCM, diazepam, etc. Enema is of two types, evacuation enema and retention anemia. Evacuation enema, treatment for constipation. You can conclude from name only. Evacuate. We have to evacuate the constipation. Retention. For prevention of local injury. We have to retention. हमें evacuate नहीं करना, सिर्फ injuries को treat करना है. Sodium phosphate, mineral oil, and in retention, bisacodyl sulfasalazine. Biphagic liquid dosage form. First is emulsions and then suspension. Biphagic, two immiscible liquids are there, like it can be of homogeneous, and this the suspensions are solid particle dispersed in liquid and suspended. This is heterogeneous, like amoxicillin suspension, diphenhydramine suspension. In homogeneous, we have two type of emulsions: oil in water and water in oil. These are primary emulsions: oil and oil in water. Like in oil in water, the dispersed phase is oil and dispersed medium is water. In water in oil, dispersed phase is water and dispersed medium is oil. Example, milk ice cream, cotrimazole. The example is butter and cold cream. In secondary emulsions, we have oil, water, oil, OWO. Moisturizing cream, burial cream, etc. Then we have route of administration. We will discuss in the next video. Thank you.